Hello, my name is Reggie, and I'll be picking up where Melinda left off. Melinda had just finished the admission process and the medication reconciliation process. So I'll be doing a quick transfer and a discharge of this patient. But before I do so, I am going to go ahead and show you how to continue the home medications that this patient is taking at home and continue them while she is currently in the hospital. So, as you look at the patient desktop, you would look onto the patient shortcuts. You would then go to the telephone written orders. Real briefly, this is not always the case all the time, as some doctors will go ahead and just enter the patient's home medications directly into your inbox. But in case they do call you, this would be the normal process. You click on the telephone written orders. You can do the bubble in telephone if you're comfortable holding the telephone and simultaneously ordering the medication order itself. Or you could do a telephone written order, which usually involves having spoken to the doctor, writing out the order, then going to the computer and ordering it again. Ordering it. The order author, we'll just put Dr. Cook. Click OK. Order co-author, you don't really need that, but in this case we'll just go ahead and put a Dr. Amstutz and click OK. Order taken by me, so I would just kindly type in my last name, hit a slash and press enter. There I am. I'll highlight that, click OK, and I'll OK that. So it brings me to the order entry block. So I want to continue those two medications that this patient came in with, and I would find that under the consolidated medication list. I'll click on that tab, and as you can see, these 2H home meds is aspirin and Claritin. So as I continue that, I'll highlight the aspirin, I'll click on copy order, I'll highlight the aspirin again and click OK. I'll click OK. And then again, if I want this medication to automatically default at 0900 as it is saying here, I'll click OK. But if this patient wants it now, for example, maybe this patient is used to taking at 7:30 or 8 in the morning, I would click an Add Now event for it to generate an 8 o'clock event on my EMR. So I did an Add Now. Claritin, I'll highlight because I want to add that to my visit meds. I'm going to copy order, highlight the Claritin, and press OK. Scroll down, click OK. Again, same thing, it'll ask you if it's automatically defaulted at 0900 or if you want to add it now, because maybe this patient is used to taking it at an earlier time than they are in the hospital. So I'll just go ahead and do an Add Now event. So sometimes when you order these medications, this red triangle will pop out, dose range, and you would just quickly look to the right under the dose range box. Action says a comment required. Okay, well, let's go ahead and read what it's saying. Loratadine oral tablet 10 milligrams, daily dose. A daily dose of 10 milligrams exceeds the recommended daily dose of 5 milligrams per day. So again, it's saying that this patient's 10 milligram dose is higher than normally of what a 5 milligram dose is. So you've spoken to the doctor and you've notified him. What you can do is click on this drop down arrow and click Contacted and Notified Physician. As soon as that happens, you'll see that there's a check on that red triangle. So as soon as you see those two, you can go ahead to your order summary. You can accept your order. And you can click on your inbox. You can hit the refresh button to make sure it appears in your inbox. And as you can see on your orders, there's a total of 3 new orders. All I know is that we did 2 new medications. The other one is your normal MRSA routine screen, and as you can see here, Claritin and aspirin have appeared. You can go ahead and select all, sign and review it. After that, those medications should appear on your BCMA IVAR. And good enough, there it is. As we move along now, I will quickly show you how to transfer a patient. So again, we'll go to telephone written orders. Again, this is not the normal case. Some cases, the doctors will do a transfer order via by the computer they're near at. Or, again, in most cases, it will be a telephone written. So you can go ahead and click on telephone written. Or again, you could click on telephone if you're comfy talking on the phone and ordering at the same time on the computer. The ordering doctor is Dr. Cook. Order co-author and someone who may work with that doctor or another doctor that agrees with it. We'll just do a Dr. Minat. Click OK. Order taken by me. We'll just type in my last name with a dash. There I am. And we'll click OK as well. So let's say this patient is just on a med-surg floor and heart rate might be a little high, and your reason for transfer is maybe the doctor just wants to have the heart monitor on this patient. So what you're going to do is go to click on order selection, which we're already at. You're going to scroll down. You're going to see right here there's a folder for admission, transfers, or discharges. So I'm going to go ahead and click on that. So again, we are transferring, and the doctor says to transfer to telemetry. So you'll quickly go on this box and you're going to look under transfer. Okay, you're going to go transfer to ICU, Doheny IC, DOU, telemetry, or med-surg. Well, again, it's going to telemetry. We'll click on telemetry and do an add order. And then you will choose which one of the doctors wants. Patient medications reviewed, all medications and IV fluids discontinued. New medication IV fluids orders will be placed. If you choose this, all this patient's current meds and IV fluids will be discontinued, and you will have to enter the new ones that your doctor told you when you spoke to him. Number 2, patient medications reviewed, all medications and IV fluids stay active. Again, nothing will be changed if you choose number 2. Whatever this patient is currently on will stay the same when it goes to tele. Number 3 option, patient medications reviewed, selective medications discontinued, and or new medications respectively added. Again, this third option will just tell you that either a doctor has continued some or has just added a few new medications. To make this training purpose much simpler, we'll just go ahead with number 2 and make sure that everything stays the same. So we'll highlight that, click OK, click OK again, and it'll be under your order entry adding order. We'll go on order summary, we'll accept the order, make sure to go to our inbox, click on the inbox, refresh, and here are your orders. Again, there's your transfer patient, and so on and so on. If you and the doctor had ordered new medications on this, they would appear here as well. If you see those, you do not sign them off. It is for the receiving nurse who gets to witness it and sign it off. Your job is just to make sure that it is in the inbox. At this moment, I am going to quickly go over the discharge of this patient. So as we are on the patient desktop, when a doctor from his computer standpoint orders a discharge, you will go to this MedRec tab, and under the completed MedRec tab, you will see something right to the right side of the discharge MedRec, the word completed. And once that's completed, it is your job to go ahead and continue the discharge process. So once I go ahead and see that, I will order a discharge order. Again, I'll just enter my last name. Click OK. Click OK. And to reconcile those medications that the doctor has okayed to discharge with, I would click under Consolidated Medication List. I would initiate discharge meds, and again, warning, once you do this, there's no going back on this. Again, do you wish to proceed? Yes. And doctor says, go ahead and continue both home medications. So if they're okay to continue, you don't do nothing to it, and we'll just click OK. We will accept that. And once you've accepted that, you can see that these two home medications are now currently under a label of D, which means discharge. So once that is completed, okay, you want to go ahead and click on the search tab and enter discharge. Again, click on discharge patient, add the order. We can just do today because we don't know exactly what time. Okay. Type will be discharged to home. Highlight that and press OK. DC interfacility transfer, again, discharge to home. If it's going to another facility, you click this one. Diet, make sure you have all this ready and handy on your brain. Let's say regular, okay. No texture changes. And you just fill it in according to your patient's diet and any other instructions it has, any wound care, any hygiene restrictions, and any activity. So we'll just click OK. Just click OK as well, OK as well, OK as well, or we can just quickly go to, click on the last line, and just OK that. It's there. We'll go to our order summary, accept the order. Make sure we go to our inbox, click on the inbox, refresh it, and then there we go with discharge patient. So we'll sign that off, and once you sign the discharge, you go to your work list. To refresh your work list, click OK. The things that you should see when you discharge a patient are, again, what you want to see when you discharge a patient on your work list is discharge patient instruction, and you want to see discharge patient. But for me, I will click on my patient desktop. I will go back to medication reconciliation. I will click on discharge med list for my patient. And as you can see here, it will populate the two medications that this patient is going home with, which is aspirin and Claritin. What I will kindly do is print 2 copies, okay, one for the patient and one for our chart, and the patient does have to sign both. And remember, your discharge instructions, which I'm going to go to right now, which is under work list, right here, your discharge patient instructions, go ahead and document. There's just another bunch of questions you have to fill out. Fluid restriction, activity, bathing hygiene, incision, wound, CHF. So for short purposes, I'm just going to click go to, OK this, and just pretend that we have done all this. Okay, pretending that we have done all this, it'll take us back out to our work list. And then after you've completed discharge patient instruction, okay, and it's off the list, you would click on discharge patient. This and then there, you will only do this as soon as the patient has left the floor, IV is all out, and all the paperwork and prescriptions and whatnot has been given. That should conclude the whole discharge process. Should you guys have any trouble, call your charge nurse.